My name is Leah O'Hara. I am a student nurse and I will be administering hydrocortisone to my patient via CIVA pump for this video demo. Okay, so the first thing I would do is I would compare the physician's orders to the MAR. I have done this already for the purpose of time. I'm going to say that the physician's orders and the MAR match and putting the physician's orders away, working from the MAR at this point. So the first thing I'm going to do is I'm going to check the medication that I've grabbed with my MAR. So my first check is right patient. I've got Volvoker number 0991211. That's the right patient. I've got the right drug, hydrocortisone, which I know from the drug monograph is Solucortef. This is Solucortef, so that's the right drug. 80 milligrams, I'll be giving 80 milligrams of this 100 milligram bottle, which because of my calculation, I know I will be taking up 1.6 ml. I'll show the calculations later. It's an IV route. I know my patient has an IV and it's given every 2 hours via CIVA. The time is now. I will be giving the medication as soon as I'm done preparing it. Okay, so that's my first check done. The second thing I would do is I would look at the drug monograph. Oh, also perform hand hygiene. So I would be looking at the drug monograph. The drug monograph says hydrocortisone, it's a corticosteroid. I know corticosteroids are used to prevent inflammation. My patient has Crohn's disease and she has a lot of irritation and inflammation in her bowel. So one of the critical kind of decisions is like knowing what you're giving your drug to your patient for, and that's so the hydrocortisone is to prevent inflammation in the bowel. I can see it's been it can be administered by a student nurse, so that's really good. And I've got a 100 milligram vial, which means I'm going to be injecting 1.8 milliliters of sterile water for a final volume of 2 milliliters. So I've got sterile water here, I've got my drug here. I'm going to begin this step. The first thing I do is I'm going to make sure to clean this for 30 seconds, let dry for 15, 30 seconds, let dry for 15. I'm going to quickly check that they're both not expired. They're both good, they're not expired. I'm going to be doing this with a 3 milliliter syringe, so butterfly pulling this back to get the 3 milliliter syringe, butterfly pulling this back, attaching. So I'm grabbing the 1.8 milliliters of water. 6, 7, 8. Great, so this is dried already. One, two, three. Pull it down a little bit more. Pushing it up. 1, 2. Okay, I've got 1.8 of sterile water. 1.8 of sterile water, which I will be injecting and reconstituting into my hydrocortisone. Okay. I would dispose of this in a sharps container. So at this point, I will roll this around, ensuring that all the medication is dissolved. While I'm rolling, I know that I'll be watching my patient for signs of hypertension, mood swings, and monitoring for hyperglycemia, so I will take a blood glucose level afterwards. At this point, I would re-swab and wait for 30 seconds. And I will also re-swab my sterile water. I will be dissolving this or mixing this in 8.4 milliliters of normal saline. This is not expired. So I'm going to grab my 10 milliliter syringe, my 10 milliliter syringe. Okay, grabbing 8.4. Okay, pushing that back up to 8.4. Good. I've got 8.4 milliliters of normal saline. Before I do anything else with this, I'm going to quickly do I'm going to drop my drug and then do my second check. So I've got a fresh left fill, attaching this, and I will be taking out 1.6 milliliters. 1.6 milliliters. 0.6. I've swabbed and cleaned this and let it dry. I've got 1.6. 1 second, I'm just going to cap this safely. So 1.6 of the hydrocortisone. So now it is time for my second check. So I've got Volvoker number 0991211, my right patient, my right drug. I've got hydrocortisone, hydrocortisone, hydrocortisone. I've got 80 milligrams. This is from 100 milligram or 1.6, which we've already checked. 1.6 milliliters is 80 milligrams, so that's correct dose. The right route is IV. The right time is now. So that is that. I will now put this and my sterile water and my normal saline in the med waste bin, and I will pull this down to just below 10. Remove this top, pull this up, and push the rest of this medication in. So now I will push this up to 10. Perfect. And grab a blue cap to close that. So I've got my final volume of 10 milliliters right there, and that is my reconstituted drug. Okay, at this point I am ready to label my drug with the medication label that I've already prepared. I will grab this, and this, and I will move to the bedside, as well as my this. Okay, so knock, knock, knock. I entered the patient's room. The first thing I'm going to do is I'm going to wash my hands again with the hand sanitizer, do a safety check. Everything is looking good. I will check to make sure that this is running at the appropriate rate. It is running at the appropriate rate. It said 22, we're at like 25, so that's really close. The line is within the right amount of time, and I do not see any occlusion. This is open. I would also check the patient's wristband and compare it with my MAR. So it says Volvoker 0991211. I'd ask the patient to state their first and last name, their allergies, which there's no known allergies, and their date of birth. So once 3 identifiers have been stated, I know that I've got the right patient. At this point, while I'm down here, I will also be checking the patency of the IV. This could be like a critical decision as well. I would check for swelling, edema, or anything else. I'd ask if the patient was experiencing pain. If all of that was negative, I would know it's an appropriate site to be giving medication, and that's an important step, I think. So at this point, I would do my third and final check with my medication. So I've got Volvoker. I know that I've got the right patient. I just have verified with the number. Hydrocortisone, 80 milligrams, 80 milligrams. It was a volume of 1.6 diluted in 8.4 with a total volume of 10 milliliters. I've got 10 milliliters for the 80 milligrams. That is the right dose. It is an IV. I'll be giving it through CIVA IV, and I'm giving it now. The time is now for 2 hours. Okay, so at this time, I will start to prepare this. This is my CIVA. This is my pump. So I will be attaching these two. So just maintaining sterility.
So my med label here, I'm going to do my before I put it into my saline here. So this is furosemide. This is furosemide, and this is furosemide.
Good. So I am moving down the tube.
And we're going to be putting this as an IV.
Okay, I'm going to prime my line with pushing a little bit of the drug up to ensure that it is primed. Okay, it is primed. So this has remained sterile. I haven't touched the tip of it. Okay, so my line is primed. At this point, I would grab my CIVA machine. Drop this, grab the CIVA machine, open it up, put that down, okay, and now I will be attaching the CIVA pump to this line down here. I do not have to flush this line, I know, because it is already running normal saline with a pump over here, and because it's a CIVA pump, I don't have to set a timer over here. What I do have to do, however, is swab the port before I attach, and I'm also going to clamp this while we wait. So I've already checked the patency of the IV. I will grab the port, swab it for 30 seconds, let it dry for 15 seconds, and while maintaining sterility, attach this line to the port. Everything has remained sterile. I will unclamp this. This is down. It should be at around 26 minutes, which looks about right. So I'm going to turn this on. So start normal. I want it to be on this normal, and I want to make sure that the audio alarm is on. Okay, so at this point, my drug will be infusing. I will sign my MAR that I have given this with my first and last name and the time. I will make sure that I label I'm going to make sure that I have a label on this tubing. I did write one. I think I must have dropped it somewhere. But this would be when this tubing starts, so February 11th at around 1:45 with my signature LOUMSN2. So that's signed. This is signed. I would tell the patient that we might experience the side effects of nausea or dizziness, maybe a little bit of mood swings, and that if you're experiencing any of these side effects, make sure to just ring the call bell and I can come and assist. I would make sure I would come back and check the CIVA pump in a few minutes to ensure that this is going down, to make sure that it is properly running through the IV line. Once this CIVA is complete, what I will be doing is I will be inserting a 3 milliliter syringe of normal saline in here to flush the tubing so as to give the proper dose and IV line. Yeah, just maintaining sterility well through it all. And the last thing I can do is I can make sure that the normal saline that has hung is still running. It looks like it's good. I don't see any occlusions. And do my final safety check, make sure that IV is good afterwards. Thank you. That is my demonstration for today.